Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is Tuesday, March 21st, 2023, and welcome to the Java Cafe. You're listening to another episode of Your Healthy Java, which is sponsored by the Massachusetts General Hospital Office of Equity and Community Health. And a few months ago, we listened to you, Dr. Alabre, who is our medical director, and also Cindy Diggs, who is our community engagement lead at Massachusetts MGB. We went live and we talked about the last year about Your Healthy Java a few months ago, and this young man and his topic was the #1 rated topic. Dr. Ross Asita is the person that the folks wanted to come back. I put the post up. Heidi, I'm not sure if you're in yet. She commented he's back. And so, and away from the fact of his presentation and just being a great presenter, it was the information, I believe, that you all resonated with, and even more important, to still talk about the importance of dental health. I put a post up and it said, how's your grill? But dental health is much more important than our smile. I've been very transparent about the fact that what you see here, which I guess now is a little bit of a moneymaker, it's been purchased. And I've been very honest and transparent about that. And it does speak to the fact about the importance of dental care in Black communities, BIPOC communities. And so without further ado, I'm going to stop running my mouth. But before I bring him in, I need all of you that are on right now to just simply go hit that share button. Hit the share button. I'm going to hold him off until y'all hit that share button and we get more people in the room. No, I'm messing. But again, good morning to everyone. We're getting ready to bring Dr. Asita in. Go ahead and hit that share button, because so many people have not had dental care since the pandemic. And dental care is much more important than the cosmetic presentation. And so, Dr. Asita, good morning.
Good morning. Thank you for the very nice introduction.
Yes, sir. It is. It's not me, sir. It was the audience in the Java family that was very moved and also informed, and really just enjoyed your authenticity and just really keeping it real about the importance of dental care. And so most of the folks here probably are familiar with you, but those that are not, tell us a little bit about yourself and why you went into dental care versus, let's say, pediatrics or cardiology. The big. Well, dental is a moneymaker too, but cardiology is, that's the big one. But tell us a little bit about yourself, sir.
Yeah. So Dr. Ross Asita. I'm a attending dentist here at the Mass General Hospital, or MGB dental group, and I got into dentistry. Well, the whole, you ask every doctor, is we like helping people.
Yes.
I think with dentistry, you get to really connect with your patients a lot more than other fields.
Yes.
They sort of build a high level of trust with their patients, and they see them quite frequently. So oftentimes dentists are asked to screen for other medical conditions, and we do lots of referrals out because you see your dentist more often than you see, your primary care physician often. And so I like the aspect that I get to know the whole family, treat everybody, develop a connection with people. And also I like to build things. And so dentistry, there's a lot of building. There's some destruction too, but there's a lot of building. There's a lot of building that happens. And you get to build something and make a positive and often emotional, meaningful difference in someone's life. Yeah. And that's pretty special. It's not a field a lot of people think about because of experiences and, past experiences that people may have had, and, biases in media towards, saying that, scaring people away from dental care, but every day we're softer, kinder, gentler people, so anyway, if you were thinking of the career, it's a good one to have. We need dentists.
Absolutely. And we need dentists like you, sir.
Yeah.
I can't keep saying how folks really responded to our last session. And let's go into the reason why. From your experience, definition, being in this field and in attending, what is dental health and why is it so important, Dr. Acita?
Yeah. Dental health is really maintaining all the conditions of your mouth. It's really about constant daily maintenance. Proper dental health is kind of about empowerment a lot. It's just being educated and being aware of what is going on in your oral cavity and how to take care of it. I'm always amazed by reports I see from patients saying like, oh, I have this, every time I touch my gums, I bleed. Well, how long has it been happening? Years and years. Well, what have you done about it? It's like, well, I don't touch it. If you were spontaneously bleeding from any other part of your body, you would see somebody right away, So I think oral health is about being able to look in there, evaluate, take care of yourself. And it's just a constant area of maintenance that we all have to go through. And so it's all about being able to take care of yourself at home, but also find and connect with a provider in your local community.
That I really want to, and I think I may have joked before, and it probably happened when you were on before, but we had one of those moments where Dr. Larbre used to see me get excited and he would go, uh-oh, because he knows I'm about to really go in. You said something that I cannot let go past us.
Sure.
In reference to, on this platform, we all often talk about social determinants of health and disparities. And what you just said was dental care or good oral health is a form of empowerment.
Oh, yeah.
And that resonated with me so much because of a lot of the diseases that are prominent in Black and brown communities. Sometimes the evidence of those diseases result in tooth loss, or those diseases, or let's talk about the fact that often people are walking around with infections and issues in their body that's really caused by bad oral health and can lead to extreme circumstances. And so can you talk a little bit more in the vein of what we know, is a lack of equity in healthcare, that empowerment piece, sir, really like in relationship to, other things that come within Black and brown communities around health, what that empowerment piece, talk a little bit more about.
Yeah, no, I'd love to. So so let's start at the beginning. So cavities are the most prevalent disease ever, that exists. So World Health Organization did, I think, one of their last big assessments in 2019. About 3.5 billion people worldwide have cavities, or oral disease. And the CDC put out a piece around the same time talking about social determinants of health and how important that is for having a healthy mouth. And the social determinants of health that determine all these other factors that you're talking about, that plays into dentistry as well. It's part of your overall health. So, and that's a story about, that it does disproportionately affect people of color and minorities, and people of lower socioeconomic status. It has a lot to do with nutrition, access to good food, access to care. Obviously, it's a big barrier. Access to fluoride, sealants, transportation, all those kind of things all play into receiving dental care. Now, like I said, it does disproportionately affect, people of color and low income. About 40% of low income and Black adults have decay. Studies are, I have some statistics. I actually did some
Please, yes,
a little review of the literature.
Yes.
Yeah.
Yep.
So yeah, that's okay. So in adults, in Black and Hispanic communities have around twice the amount of cavities of the general population. And it actually gets worse in children, around 3 times the amount in low-income children. Okay. At the age from 2 to 5, about 33% of Mexican, 28% of Black and non-Hispanic, and 18% of white have oral disease. And when you bump it up to the age from 12 to 19, it jumps up a little bit to 70%. So it does definitely just proportionally affect minorities, people of color, low income. So health equity plays big into this. And like I said, a lot of this is about empowerment. So most of this disease, if the proper education programs happen, access in school programs to oral health care, it makes a huge impact and greatly reduces these numbers. That's why having these initiatives is just so important.
Dr. Acita, one of the things that stood out there when you talked about education and information and prevention was, I remember when I was in elementary school, the nurse would come around with fluoride, and we would have to rinse with fluoride like once a week, if I remember right. And so I'm not aware that that's still available. And I just wanted to maybe move us in the prevention piece, but I could not let that piece of empowerment just go by. And when you said transportation, like on some levels, okay, a no-brainer, people need to get there, but to hear you articulate that as a contributing factor, and then to hear the stats about the disproportionate impact. And so why is it so important that you talked about daily maintenance when you first opened up? Why is it so important that we stay on top of dental health beyond the smile? How do we do some prevention before we get to the worst? When you talked about the decay, the numbers, and then in children, you would just presumably think that, kids are getting to the dentist, the parents are getting them there, but there's also a lot of empowerment things there. How do we prevent it from getting to absolute worst where you need an extraction or, let's talk about some prevention. One thing I will say, and I do differently now, is we talked about hard, soft brush. We talked about no matter what, just softly. It's the amount of strokes and the consistency in brushing your teeth that stood out. So let's talk about some other ways of preventing a lot of what you just named with those stats, which are just alarming.
So early education is really important. Reinforcing in our children, brushing twice a day for 2 minutes. And I know it's hard to do, but you got to find the time. I cheat in the morning sometimes, I'll be honest. Okay. But at least
your transparency, this is why they love you.
But I at least do 2 full minutes at night before bed. Okay. That's when I have some time. Mornings are a little crazy, right? But at least do one of those for 2 minutes, ideally, but really two times a day for 2 minutes, and flossing nightly. And that those 2 behaviors in combination are, just the centerpiece to oral health care, right? So just really consistently, lighter, longer is my catchphrase for brushing. Okay. So lighter, longer, just enough pressure to depress a finger pad is all you need. If you're pushing, I say don't hold.
Doing this is not going to
for your gum. I don't like holding a toothbrush like a sword. Okay. You don't know how hard you're pushing, what you're doing. You don't have a lot of dexterity, but if you use it like a wand, okay, and with a little finger forward, you know how hard you're pushing. You can kind of direct things around a little better. Okay.
I just realized I hold my tooth. This is actually, I do. Well, to think it's like
this. You might change grips a little bit, but just a wand is better. So that way you know how hard you're pushing, and just go tooth by tooth by tooth. Be really systematic about it. No zigzags all around. You're going to miss things. But if you go a little vibration along your gum line, tooth by tooth by tooth, right along the gum line, and then hit every other surface as well. That's the proper way.
What about the back
I always say that brushing your teeth is a lot like driving a car. Okay. Everyone thinks they're the world's greatest driver, but almost nobody is. Okay. Same thing with brushing. Everyone thinks, oh, I know how to brush, but almost nobody does it correctly. So make sure you're taking your time doing it. As strange as it sounds, it's a medical procedure you're doing on yourself. Okay. And you just have to be really systematic and careful as you go around. Okay. So, we talked about cavities, and you're mentioning sort of systemic health. So not taking care of your gum health. That is basically, if you have swollen, infected gums that bleed when you touch them, it's your body asking for help. Okay. It's equivalent essentially to having an infected cut. Okay. So your body is trying to mount a defense against the bacteria stuck to your tooth, but it's something that it can never get at and get rid of the bacteria. It relies on you or a dentist to get in there and mechanically remove it. Okay. Otherwise, your body just sits there and tries to fight it all the time. And it's a fight it can never win. So what they found now is that having that constant inflammation and stress in your body affects a lot of your other health systems. There's direct correlations with heart disease and with diabetes. Those inflammatory conditions puts a whole strain in your system. So all of these inflammatory cells go around your body and can mess up control of all your other systems. Okay. So what we find, I'll use diabetics as an example. So diabetics, it goes back and forth. So both of those play into one another. With diabetes, that it's not well controlled, it affects your immune system, and then affecting your immune system affects how well your body can respond to the gunk on your teeth and dental infections. And then the dental infections and gunk on your teeth, inflammatory, all the inflammation and stress in your body there throws off your blood sugars. So these things just kind of play into one another, and it keeps building and building and building. And so we find patients who have a lot of gum disease and uncontrolled diabetes. We could treat their gum disease, and all of a sudden their blood sugars become a heck of a lot easier to control. So yeah, again, we talked about it. You can't be healthy without a healthy mouth. So it's one of obviously I'm biased, but it's one of the most important parts of your body to take care of.
It is. It really, really is. And I joke about the cosmetic piece, but there is some significance to that. And I've been, I asked Dr. Cito, I was like, you accepting patients? He said yes. And so, somewhere, not too transparent, but somewhere along the line, I may take you all on a journey with me about just getting into good and better oral health. Very transparent. I don't want to be hypocritical. And so I have to be on top of mine as well. And I'm sitting here and you're talking, I'm like, ouch, 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 because it personally, but then also with what you said about the empowerment and knowing that heart disease and diabetes typically or are a very prevalent disease in Black and brown communities. So that correlation, and when you talked about systemic health, that really stood out as well. And so we talked about the importance of light and long brushing. We talked about, can we talk a little bit about maybe the back of the teeth, making sure you do that? And then also, what is your opinion versus old school? And look, I'm still doing it rough. What is your definition of old school flossing? And then with the pick one versus, and this, y'all, this is not an endorsement of either way or no brand. Just what he observes as,
Sure. Yeah. So, I am very transparent and honest, and as you know. So technically the best way of flossing is to use a big long piece of string, wrap around your feet. You wrap around these fingers here, okay, and then you direct it with this.
Are you serious?
I can grab some floss.
Go ahead,
with your pointer fingers, and then go around and go tooth by tooth by tooth. I got in trouble in my early 30s for not flossing enough. Okay. So I was guilty of it. And a lot of it was because I was just too lazy. I didn't like drooling on myself with a long piece of string, but technically doing a nice gentle C shape around each tooth with that long string is the best way. But, there are barriers to treating yourself, right? And so we all have busy, difficult lives. So I found what was effective for me to build the habit was using those little picks, those little bow picks, right? So they technically aren't as effective Environmentally, they're not as good either, which my wife tells me about all the time. But I found that I really wanted to build my flossing habit. So building any good health habit is all about reducing the friction to actually doing it and figuring out the way to make it the easiest for you. Okay. So it shouldn't feel like a burden. So what I did is I started putting those picks everywhere. I put one by my computer. I put one in my car. I put one on my nightstand. And whenever I was sitting there doing nothing, I was like, oh, well, I could just floss. And so I started flossing. And what I found was the spot where it was most effective was for me was on my nightstand, because I would just see it on my way to bed and say, oh, I didn't floss. I forgot to. Okay. I just grab it. I lay down. My wife hates it, but I just floss in bed. Boom, 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 boom. I hit every tooth and I put it down, and that's it. I'm off to sleep. Okay. So I reuse them until they break again. You know, it's probably not the ideal. I was going to say,
way, is that okay? Because we tend to, especially with the environment, is 1 or 2 times, because most folks use it, and I would think you use it and just throw it out. So there's not a lot of risk of.
So a lot of periodontists who are gum specialists would, are probably yelling at me right now. But I just give it a rinse, and reuse it until it breaks. It's totally fine. Okay. But ideally you should be changing it out each time. But like I said, it's what works for me, and find out what works for you. If you do something that's sort of logical and that you can manage and motivate yourself to do it, I'm all about that. That's what you should be doing then. Okay.
Absolutely. I wanted to bring in the same young lady that I told you was so excited to see that you were coming in. She just had one little comment about the pick. But Heidi, we're going to get to your question in just a few moments. Okay, so light and long flossing ideally, and I learned something new, because I think we are more inclined to just do 2 fingers, which I think also adds to maybe pressure and evasive flossing, because you're harder. So you say wrap it around these 2 fingers.
Yeah, here I'll grab.
Go ahead.
A piece real quick.
While Dr. Asita is going to get the floss, I just wanted to remind you all that we do have a survey going on, and you can, I didn't pin it to the comments yet, but you can fill out the survey by going to jwj.info/YHJ, and I put survey. It should be survey. But go there and fill out the survey, and we'll reiterate that again. And so now we're going to have, I think this is the first time, Dr. Asita, that we had a medical demonstration.
Demo.
Demo. Watch out now. Let me put you on full screen.
Oh, wow. All right. So use a big, I can't even show you. Let me back up. Use a big, long piece. Okay. Big, long piece. And then take it between the 3rd finger here and your thumb and kind of wrap it around. Okay. I guess people call these a ring finger. I got my wedding ring, so that reminded me of it. So now you have it kind of stuck on your fingers. I don't even need to hold it, okay, as you kind of wrapped it over itself. And then you put your pointer fingers, go forward, and you can reach around every tooth, okay? That is technically the way professionals in the biz floss, okay? Again, do what works for you, but this is the ideal way, okay? And then you floss, and let's see if I can... floss down, and you basically want to imagine making a C.
You better go ahead and demonstrate, Dr. Asita. Yes,
a C shape around each tooth. So you basically, your tooth is like an ovoid shape, so it's like an oval sort of. So you want to imagine kind of gently going along the tooth and back up, and that's it. And then you go to the other tooth, which will be right next to it, back up and down. So a lot of people, when they floss, they go just straight up down and like kind of jab into their gums.
Yes.
That's not the point. The point isn't to jab into your gums. Like you are achieving something by breaking the bacteria out from where the teeth touch.
Yes.
But you really also want to make a C shape around each tooth and go gently under your under your gums and back up. No sawing motion, no pulling real hard, a nice gentle C shape. Okay. Again, lighter, longer is the way of all hygiene. Just enough to depress a finger pad is all you need. Just nice and gentle. Okay.
Dr. Asita, I was today years old. So first, I'm going to listen, and all by get an understanding. And so I'm not the only one that thought this. And so when I used to hear the reference to C shape, I thought it was the way in which I can't even
Like,
explain it.
up,
Sometimes
up towards your gums, like you're trying to cut your gum. No, you don't want that. Yeah, C
so the
shape
C
towards
shape
your tooth,
towards your tooth. So
like you're giving the tooth a hug. Like you want to just give it a warm, embracing hug and just clean it.
our
Okay.
teeth need hugs. Care. Oh my goodness. So I'm sitting here and I'm like,
Yeah.
but though this is good and we're kind of joking, but this is a demonstration of the importance
Mhm.
of early education. Had someone came into
Mhm.
school, sat with me, maybe the dentist did, I don't remember, but I
Mhm.
can honestly say that is the most comprehensive demonstration of
Mhm.
flossing that I've seen in my life. And
Mhm.
so
Mhm.
that's
Mhm.
where that early education comes in. I'm
Oh, for
51
sure.
years old, and
Mhm.
just getting to a point where you just simply took a water bottle and
Mhm.
floss. The other thing that I noticed was we have to be generous with the floss. It's not because I used to try to use just enough to, and
Mhm.
this is the part that used to kill me, wrapping it and it would get loose.
Uh-huh.
And then so we learned a new technique today, how to
Yeah. Yeah. Yeah.
floss. All right,
So,
go
but
ahead.
for people who have dexterity issues, there are other implements that you can use. So
Okay.
those little picks are a lot easier to use than a
Yes.
string. Okay, which I think is good. There's even flossers with bigger handles and ones that instead of it's in the same plane, it's bent 90 degrees. So it's a
Okay.
lot easier to get to the
For
back teeth
access.
as
Yep.
well. So patients who have dexterity issues, it can be very, very helpful. And even if you have difficulty, arthritis or other conditions where you can't make a good grip, you can even take a towel and wrap it around the handle of these things. So that way it's a big grip and it's easy to do. So,
Absolutely.
again, I'm all about what you want to achieve is just nice, gentle hygiene along your gum line, between your
Yes.
teeth and over every surface of your tooth. And however you can get there, you kind of have to be a little bit creative sometimes if you've got, any difficulties with
Yeah.
dexterity. Reaching
Time
back
and
there.
dexterity is just for those that may
Yeah.
not understand. It simply means mobility limitations. Either you have issues with reaching that back area. And so let
Mhm.
me ask you also about this. Not suppressors, tongue scrapers.
Tongue scrapers. Yeah.
It technically is not teeth, but it's part of oral health.
Of course. Yeah.
What is that? Well, when I've used it, and I got to get a new one. The only way I would say I can answer my own question is it beneficial? I will say yes by the fact that sometimes when scraped, I'm very afraid. And when I see, I'm like, ooh. So
Yeah.
I'm answering my own question. Can we talk
Mhm,
a little
mhm.
bit about tongue scrapers?
Yeah. So everybody's different.
Yep.
Okay. Everyone's tongue is different. Okay. Some people, your tongue is covered in what's called papilla, which are these like
Yep.
little fingers
Yeah.
all on your tongue. Some people have very short ones. Some people have longer ones. Some people's are longer and they actually separate, and it's called fissured. So there's all different forms of it. So for people who have um, tongues with those little longer papilla, it can harbor bacteria. It can be a big contributing factor to halitosis, otherwise known as bad breath.
Yep.
And so by using a scraper, you can actually scrape out the bacteria that can build in those fissures, and actually dramatically improve your breath and lower the overall bacterial load that's in your mouth,
Okay.
which is always a good thing, right? It should
Absolutely.
always be a goal. So as far as it affecting your teeth or anything like that, being a source of caries, it's not really.
Okay.
I think it's more of like an aesthetic and breath issue, so that way when you get close to people, they're more welcoming of your closeness. And I would say just try not to overdo it in some very small percentage of the population. Sometimes if they try tongue scraping, it can cause some inflammation.
Yep.
So just go easy on yourself. Okay.
Okay.
Give it a try, start gentle and kind of work your way into it. And don't cause any undue trauma, in the aim of trying to get good breath. Okay.
Yeah, pop a mint and then brush your teeth.
Yeah.
So Papa sugar free. Yeah,
Yeah,
we'll talk
there
about
you
that
go.
because
There you go.
that revelation of sugar that you gave in our mouth,
Yeah.
folks are coming in with the questions and comments. One in relationship to the carrying the tongue scraper is Miss Teresa said use your toothbrush instead. And so there
You can.
is
Yeah.
the brushing the teeth basically does the same thing that you just referenced to of the scraper, correct?
Yeah, well, I mean, brushing the teeth is just taking
I mean,
the bacteria with the
tongue.
tooth,
I'm
but you can use the toothbrush on your tongue.
Yeah.
But the same kind of precaution. So it is also effective that way. Yeah.
Okay. So we have three essential ways of prevention, which is light and long, daily brushing 2 times a day for 2 minutes.
Mm-hmm.
Then you get your floss. You wrap it around your
Ring
wedding
finger. Yeah.
ring
Yeah.
finger,
Yeah. Yeah.
ring finger, and then you guide it with this one.
Mm-hmm.
And when you're guiding it, you put the floss around the tooth and cause a C shape with the
Mm-hmm.
floss, and you just guide it up and down against the tooth like that. You can lightly hit the gum,
Yeah. Gently under the gums. Gently under the
gently
gums as
under the
well.
gum.
Yeah.
Because
Yeah.
I'm inclined when you hit the gum to kind of give it a little bit extra so you can get it up. No. Gently on the gum, up and down, and you do that to each tooth, and then you switch sides and do it to each tooth as well, top and bottom.
Top and bottom, and even where you don't have a tooth. So if you're missing a tooth or on the last tooth in the arch, even go behind your little very back tooth as well. All right, because there are gums and there's a gum pocket back there, and it's good to kind of gently get in those areas too. Okay, so I have patients who say like, oh, well, I'm missing teeth, so I don't need to fully floss. I'm like, no, you need to floss just as much as someone with all their teeth, even though you're missing teeth, because each one of those teeth is just that much more important. So you should be taking that extra time and just gently use that extra time around each tooth. So still 2 full minutes, still flossing every surface. Okay.
I smile because I have a couple of teeth missing, but I'm glad that I did have the inclination, because to me, I'll be honest, I was like, there's more room to get in there.
Mm-hmm.
So, it's like you can't disregard it. Like you can actually do a little bit more maneuvering because you got a little extra space there. So I'm gonna leave that alone. All right. So we talked about those three things, and we did already touch, but maybe you talked a little bit about what are some of the things that if we don't prevent tooth decay, and also other things that come with not having good oral health care. And so what are some of the other things that may result in, we know there's tooth loss, we know there's decay. You talked about contribution to possibly diabetes in your body, heart disease. Is there anything else that can be a result of not taking care of your oral health?
Sure. I mean, for a kind of a public health big picture view, I got more stats for you.
Come on.
There's 34 million school hours lost per year from having dental infections. You need to urgently see a dentist. Okay.
34 million?
34 million.
And primarily that's school hours. And so that's children.
That's children. Yeah. Yeah. And then the estimate is 45 billion in lost productivity for adults. Okay.
Well, that's work hours.
As work hours. Yeah.
This is why employers need to come up with better dental plans. But go ahead.
Yeah. That's
an investment.
Yeah. So I mean, so what can result? So tooth infection, tooth loss, contributing towards inflammatory systemic diseases, contributing towards heart disease, diabetes, and then in most dental infections, luckily, don't rise to the level of hospitalization urgency, but they can. And so if you have something, it's best not to ignore it. Seek help. Okay. Yes. If you can't connect with a dentist, you can connect with a primary care or a physician of some kind, or you may have to go to the emergency room. But treating dental infection with antibiotics is important to control, and then actually get definitive care from a dental professional to clear you of those infections. So it's important not to ignore those things. I mean, the chronic infections and broken teeth, are prevalent. I understand. Again, there's lots of barriers to care, and they can sort of ebb and flow with pain. I know people, I see it all the time. It's like, well, this tooth hurt for a while,
it don't hurt no more, so we'll leave it alone.
Stopped hurting, and then now it's come back again. Yeah, and it's extraordinarily common and totally understandable. Even if you have all the means in the world, people are still reluctant to show up. Okay, but it's something that dental problems, like all problems, the more you ignore them, the worse that they get. So it's important to kind of seek intervention early. I think the main thing is, and we're in Massachusetts and we have some access through Mass Health to get dental benefit and urgent care if you qualify, and actually full comprehensive care. Mass Health right now covers a ton of care. So connecting with a dental professional is important before these things arise, or even if you have the suspicion that something comes up, because if you wait, a cavity doesn't really hurt, okay, until it gets all the way to the nerve, basically. So then once you're at the nerve, you've got an even bigger problem, okay? So it's important to, again, do your home care, okay, which also we should talk about fluoride too. But do your home care, including fluoride and brushing, flossing, but also connect with a dentist so you can be screened for these things that don't necessarily rise to the level that you're even aware that it's an issue. Because if you wait until it does, then you're needing a root canal and extraction, more invasive, more expensive care.
Yep. It's interesting because we talk about often in other areas and parts of the body that the issue doesn't demonstrate itself to until a point to where it's, because the body's really trying to fight off infections and things, and then when it isn't able to anymore, then you have a demonstration that things have got worse. And usually, most of the time, thanks to skilled folks like you can do some recovery and help and whatnot. But one thing about the teeth, that once they start, cracking and stuff, it's interesting. And again, I'm talking from experience. So, Dr. Sita, if it's okay with you, we're getting ready to go in and maybe answer some questions, maybe respond to a couple of comments. We already seen Heidi's. Heidi, don't judge Jesus. A couple. Oh, is it okay? So we were going to talk about, you mentioned fluoride. Teresa is asking from out in Worcester. Also, is it okay to rinse with diluted hydrogen peroxide daily? I remember seeing that around or whatever. Is that, again, Dr. Asita has not examined anyone, so he's just giving general information. What is your response there?
Dilute hydrogen peroxide is an acceptable mouth rinse. Okay. There are over-the-counter products that could be used. I think it might be a Colgate product called Peroxyl is a hydrogen peroxide over-the-counter rinse that's properly mixed. Do not do it full strength at all. You want to dilute it over 50% with water.
Over 50%. Okay.
Over,
you hear that, over
50%. Yeah. So just be careful with kind of doing home sort of chemistry. All right. Because you don't want to.
And if you know Miss Teresa, she'll get to experiment. Nothing crazy.
But yes, it is an acceptable treatment.
Okay. One of the other questions, can you talk a little bit about receding gum lines?
Sure. Yeah. So receding gum lines is often associated with periodontal disease, so gum disease. So we were talking about patients who have bleeding gums and then they don't do anything about it. And the solution often is as well, I won't brush on my gums anymore. But that just leads to more inflammation. And so we were talking about that your body is basically trying to fight off that bacteria that's under your gums, causing that inflammation. So the body starts to look at your tooth like it's a splinter and says, "Oh, this is bad for us." And so just like if you had a splinter in your finger, your body would slowly push that splinter out and push it out of your body, right? So if your tooth is covered with bacteria under your gums and your body's trying to fight that off, what your body does is like, "Oh, this is bad for us. Let's get away from it." And so the bone will start moving away. And when the bone starts moving away, sometimes the gums will follow, right? And then eventually you've seen people with long looking teeth. And then eventually you could result in tooth loss in extreme conditions. Wow. There are other causes of just having recession in areas. Some can be due to bone loss from just the way your teeth have grown in. That can sometimes exist. Okay. And then it also can be associated with like clenching, grinding, believe it or not. You can grind your teeth so hard or be missing enough teeth where your teeth don't have enough support. And just like having a pole in the sand, if you start shaking that pole around, the sand around it is going to start moving and getting loose and getting dropping. So that same thing can happen on your teeth. So really seeing a dentist As far as correction, clearing yourself of the gum disease, seeing what height your gums are going to be left at after that. There are different procedures where they can actually graft in new gum tissue and have it kind of readapt around the tooth. So there are corrective procedures in certain cases that can be done.
And very expensive as well. So it
Mhm.
just save the money and brush and do what we need to do.
Mhm.
Question from Teresa as well. Are those three-headed toothbrushes a gimmick, or do they actually work?
Is it one of those ones that wrap around your teeth? I wonder. So, yeah, I usually recommend a smaller head toothbrush. So,
Okay.
yeah, I think it's sort of a gimmick. Can you be effective with any toothbrush within reason? I think as long as it's a reasonable size and is soft or extra soft, I would look for only American Dental Association accredited products was how I would look for that seal. So, like I think building a good habit is important, but taking too much of a shortcut is probably not the best idea. Usually, I recommend a small-headed brush with a soft or extra soft bristles.
And again, long and gentle.
Yeah, yeah. Lighter, longer.
Lighter, longer. That's it. That's it. Doctor Pastor Marion, we see this here. Dr. Asita, and I don't mind speaking for him, he may not be able to make referrals, especially outside of MGH, to other dentists. But what is the number for dentistry, Dr. Asita? Because I know that's going somewhere before we get ready to get off. That's going to come up, and I kind of need the number as well.
Our number here?
Yes.
Oh, 617-726.
Yep.
1076 is our office number.
All right.
Yeah.
And the clinic is accepting patients, correct?
Yep.
The clinic
is accepting patients. Yeah.
The dental clinic at MGH is accepting patients, and that number is 617-726-1026.
1076.
If I can read my own writing. Okay. So we'll put that number up in a couple of seconds. I just want to make sure I'm not missing any questions.
Well, I mean, in answer to Marion's question, I mean, I would just try to connect with local dentists, and you basically want to treat it like an interview. Make sure it's someone who takes time with you, who you connect with, who you feel like you could come to trust, maybe eventually, at least. If you're lucky enough to have dental benefit, make sure they're within network of your dental benefit.
Yes.
If you don't have dental benefit, the state has lists of people who, I guess, do take Mass Health. And then also we're lucky that we have 3 dental schools in our state, and they do very much reduced fee care as well. So there are resources. You can go to the Mass Dental Society webpage. I think the state has a webpage as well through Mass Health, where you can look at that list. And then I think those are probably 2 of your best resources.
I wanted to just, while you were talking about the resources, Sharon, I say her name 3 times. So Sharon Cornelius, good morning. What Dr. Asita just mentioned can also be applicable to seniors, because we also just want to highlight that seniors sometimes, for various reasons, transportation, just life issues or whatever, may not always make it for their routine and preventive health care. And so I just wanted to raise that, Sharon, to you as well, that those resources that Dr. Asita just named would be applicable to looking for resources in dentists and resources for seniors as well. Pastor Marion is asking, what are your thoughts about tooth implants?
Yeah. Dental implants are great. They're an excellent replacement for missing teeth. You have to have enough bone. You have to have a healthy mouth to receive them. So I think I'm a dentist. I think there's nothing better than a natural tooth.
Yes.
The way that implants are marketed on TV, you see someone walk in the door and they're like, "Oh, I get all my teeth out and I have full implants," and then I walk out in a minute and I'm smiling. It's not something that you should
like
sort of look. It's not like that, and it's not something you should sort of strive for as a replacement of taking care of what you have. So really, really, really. Dental implants are great. Their success rates are astronomically high for in medical field, the percent rate for success rate for implants is like 97% and higher. So it's a tried and true treatment, very stable. But again, take care of your natural teeth as much as you can. Yeah, the best gift that you have. Yeah.
Those are all, and again, being transparent, those are alternatives for maybe folks who did not have this information and education early,
Mm-hmm.
went to the worst, and folks like who may need to just be a little more confident,
Mm-hmm.
maybe appear and talk a lot, and don't want to slip something, risk something slipping out. And so that's an alternative. It is expensive.
Yeah.
And so, the least expensive and best way is to take care of our teeth. But there are some of us who miss opportunities of education, practice due to life and whatever. And so those are that's an alternative for folks as well. My sister is asking, what's wrong with three-headed toothbrushes? He didn't say anything was wrong with them, but can I just keep it real, doctor? Well, sometimes in some industries, you reference to this, that like the dental implant commercials, sometimes the marketing of things isn't exactly our full experience once we stop watching television. And so he did recommend to Misha a smaller toothbrush, not light and gentle. Yeah, light and long and gentle, right?
Lighter, longer.
Lighter, longer. Lord,
Yeah,
Jesus.
2 full
Lighter,
minutes,
longer.
nice and gentle. Yeah, exactly.
LL, lighter, longer. Okay, just like the JJ. Remember,
Yeah.
like we're going to get you a hat.
Yeah,
LL to Dr. Asita. All right. What about charcoal toothpaste?
Yeah. I'm not sure if any of the charcoal branded toothpaste have ADA seal of approval, which means that they've actually they've done a peer reviewed study on it to make sure its efficacy and safety, that it's effective and safe to use. So I just personally, I think that they're a bit abrasive. And so like they're marketed as a whitening product, which I think leads people to brushing more heavily and causing erosion and wear on your teeth. That way isn't the way to get white teeth. So I think a lot of this is sort of a little bit of a gimmick, because when you brush with something dark, it makes your teeth look really white right after, just because of the contrast color and the trick of the eye. But I would instead save your money and just get a non-charcoal toothpaste, and then try like a Crest White Strip or one of the White Strip products. And again, look for an accredited one. I know on the internet you can find all sorts of stuff.
The whitening stuff, because that can be detrimental if you don't use it right. They can be evasive. Can they cause issues with enamel and stuff?
Yeah, I mean, they're very safe to use if used properly by the instruction. It does work by taking away an outside layer of your tooth, but then it often just remineralizes, as long as you're doing it properly, from the own natural solutes in your saliva. So so it is a process that sort of takes away, but you have the ability to resurface the tooth slightly. So just make sure you're using a approved product and getting it from a reliable source, and doing it per instructions. Don't go you get too creative with that.
I love how you said too creative. Teresa said, okay, I'm feeling some way about these gimmicks. I mean, this is one of the reasons that we come in, we bring experts into this space. Marketing and gimmicks are what they are, but here on Your Healthy Java, you can always find factual, truthful information, from dentistry to alcohol and substance abuse to all of that. And so Dr. Asita is just one of the great experts that we've had come in. And I'm sure they're going to probably ask you to come back maybe again, because I learned additionally something new today from the last time, that the flossing thing. I'm like, wow, that's a shame though at 51, that just seeing it demonstrated like that is really been good. Before we let you go, we just want to make sure we don't have any more questions. Peroxide, periodontal disease, seniors, can anything be done about bone loss? This isn't a real full dental question, but go ahead, Dr. Cedar.
Sure. Well, I mean, I'm going to assume Deborah's asking about like bone loss around your teeth.
Okay, gotcha.
In certain spots, some things can be done. There can be grafts, but they're very limited. So most times when someone has gum disease and they've lost bone around teeth, it's very difficult to graft it back in or grow it back. So really, prevention is the way to try to avoid the bone loss. If you do have bone loss, you should connect with a dentist and perhaps a periodontist who's a gum specialist who can try to treat your gums and bone to make them in the most stable form so that way you can maintain what you have. So you just need to connect with the providers who can help you out.
Okay. I see one more question about toothpaste, and that'll be it. Charcoal powder and pumice powder?
Yeah, I mean that again, the powder and pumice powders are abrasives.
Okay.
So it's the same thing about the charcoal toothpaste. It's the same precautions of it. It might be a little bit too abrasive for most patients. Yeah, don't recommend. Again, look for the American Dental Association approved products. Yeah.
Okay. Dr. Acita, is there anything that you would like to leave with the audience? We will put the phone number for the clinic. This doesn't mean that it's going to be Dr. Acita, but the phone number is 726-1076. I always used to get confused with the 724 and 726 over there. So this is the number to call the general clinic and ask them if you can sign up to be a new patient. And you can definitely go from there. Was there anything that we missed, Dr. Acita?
I'd just like to reiterate the point about empowerment, really. I think it's amazing that how many patients I see who have just never been sat down and told how to take care of themselves. And therefore they got busy, difficult other things going on in their life. And so it's very easy to neglect this one aspect, walk around with gums that bleed, but I'm not brushing there so it doesn't hurt. But taking those first steps, doing the hygiene as we recommended, and if you just work through it, you'll start to notice a change. It'll take a week or two, maybe. You'll see blood in your saliva and in the sink. Don't be afraid of it. Just gentle, keep up with it. And what you'll find is it'll slowly decrease. And even your gums will sort of feel tighter and healthier. And that's really the first step towards, your oral health journey of figuring out how to best take care of yourself. And instead of ignoring a problem that can become a bigger problem later in life, take those very first small steps early. Okay. And even if you already have a lot of problems, don't give up. Just take care of what you have, connect with dentists however you can. Yeah.
Dr.
Discover the importance of oral health. Yeah.
I really, really appreciate you. I appreciate you stopping and doing this in the midst of you being there with patients, getting ready to go see patients. And so once again, we just want to say thank you for taking the time and coming in and sharing it with us. We got a little.
My pleasure. Yeah, my pleasure.
Don't be surprised if we don't reach out to you. Dr. Lavery reaches out again and says, hey, they want you back.
I'd be happy to
dig a little bit deeper into some of the things we talked about today. But thank you for that empowerment piece, because hopefully folks are leaving empowered with new information to help them take better care of their oral health.
Yeah, happy to be here. Thanks for having me.
Folks, we are going to just share a few things about Saturday, but I can see why you all wanted him back. I enjoyed him as well. I learned some things today. And so, yes, I was sitting up here while he was talking, going, feeling my gums and a couple of spaces there. But do me a favor, everyone. Please take a moment and fill out the Your Healthy Java survey by going to JWJ. I'm actually going to go ahead and pin that to the top of the comments right now. Most of you here have probably taken it, but if you have not, please go take the survey so we can continue to hear from you about other subjects and things that you would like discussed here in the Java Cafe for Your Healthy Java. Let me just get this up here real quick and pin the comment to the top. Turn the volume down because all right, here we go. Oh boy, y'all got a lot. I can't even find the comments, Jesus. All right. All right. I can't get to the comment because y'all got so many in there, which is cool. And I love it. Thank you all for tuning in today for your Healthy Job. I just wanted to remind you, for those of you that have not heard or did not register, and let me say this, please register. Don't just show up and not let us know that you're coming. All right. So please go to the link. It is case sensitive, all lowercase, jwj.info/3 years. This is where you can go to register to get free tickets for Saturday's 3-year celebration of Java with Jimmy and the Red Cup Awards. Those are taking place on Saturday from 7 to 9:30 p.m. DJ Newt will be with us. Listen, we are coming together. We'll have a couple of greetings. We're going to give out the awards. We're going to have some refreshments. DJ Newt is going to spin, and we're going to dance and have a good time and celebrate 3 years of coming together. Just in a very interesting place as we're approaching the 3 years. It's still kind of unbelievable that 3 years went by. I told somebody yesterday that it still sort of baffles me that we're here, that this happened. And so that's just kind of why I paused there. But thank you all for tuning in today. We're going to get ready to go. Tomorrow, our mayor will be with us. Mayor Michelle will be with us tomorrow at 9 a.m. We're going to do a little something different tomorrow. I'm going to talk to the mayor for a few minutes, and then the mayor and I are going to switch roles. She's going to chat with me. So definitely tune in tomorrow morning. We're going to talk with the mayor first few minutes, catch up on some things. There's so much going on. But then we're going to switch roles, and the mayor's going to chat with me about, the past few years in Java with Jimmy. May lead in some. It's going to be interesting seeing her in the interviewer role. And so tune in tomorrow at 9 a.m. and we will see you then. Have a great day, everybody. Don't forget to fill out the survey. All right. Please go and fill out the survey so we can know what you think about your Healthy Java, other topics you would like us to discuss. And that's pretty much it for me today. So we will see you tomorrow morning with Mayor